Hello, everyone, and welcome to another episode of Mind, Body, and Roots. Today, I have my friend Dr. Jackson Sadler. He's an oral surgeon out of Charlotte, North Carolina. He's someone that I really look up to. He's a great guy, and he's someone I met through the ADA during our IDL time. And he's got such a crazy story and just some cool pieces of advice. So, without further ado, I'm letting him introduce himself. So, go ahead, Jackson.
Thanks, Ahad. You're far too kind. As you mentioned, my name is Jackson Sadler. I am an oral and maxillofacial surgeon practicing in the greater Charlotte, North Carolina area. And I'm happy to be here today. I'm looking forward to talking to you.
Absolutely. No, thank you for taking the time on a Sunday to, talk about this with me. So, Jackson, talk to me about you growing up. What was it like in Winston-Salem, North Carolina? Talk to me about, your craft and your fitness routine. I just want to kind of know all about you, basically. And we'll start with your craft. How did you get into OMFS? What drove you that way? What do you like to do? Go right ahead.
Yeah, so that's a great question. So I guess to start, I should mention I've got a family background in medicine. My mother, she is a family medicine physician. She works in Winston-Salem, North Carolina, and my father, he's retired. He was a general dentist. Pretty involved in organized dentistry as well. He's still involved in organized dentistry. So just kind of growing up, I was always around healthcare and medicine. My mom actually sent me to like medical school camp when I was a teenager. I hated it. It was terrible. I, but so it was just kind of a constant thing. So I always felt like it was something that I wanted to do. But to be honest with you, when I was about to graduate from college, it was in April actually. And my parents came to me and they were like, so what's the plan? What are you going to do? And I was like, oh yeah. It's like, I guess I do have to decide. Graduation's in like a month. So my dad was, he just kind of seemingly offhandedly just was like, there's a Mission of Mercy clinic, volunteer clinic that kind of moves around the state. He was like, yeah, Mission of Mercy clinic is happening down where you live. It's going to be in a few weeks. You should check it out, see if it's something you're interested in. So the first time I went, I didn't really do very much, as a volunteer at that stage, they kind of have you like directing people and similar things, but I enjoyed it when I was there. So I convinced my dad to go and volunteer as a dentist. And I went and volunteered again, helping people with various things around the clinic. And I remember there was this woman that came in and, just small talk, waiting to take her over to the place where she was going to be treated. And she told me that she had driven from 6 hours away. She had gotten there at like 6:30 in the morning to make sure that she was able to be seen. And she had cavities across her front teeth, like most of them, like 5 or 6 of them. And we got her over to the place where she was going to get treated. And she sits down and the dentist says, it's like, okay, well, what are we working on for you today? And she says, oh, I need these fixed. And either that dentist or someone that was there was like, oh, we're only supposed to do like one, maybe two things for you just so we can make sure we treat as many people as possible. And, at this point, the woman starts getting emotional and she's just kind of crying a little bit. And, at a certain point, the dentist that was there says, you know what, I'm just going to start working on things. If somebody's got a problem with it, they can come talk to me. And, I went about my day. I went, kept helping with other random things, but I came back to check in and see how things were going every now and then. And I just remember at the end of it, they fixed this woman's teeth. And she looks at her smile in the mirror and, she just starts crying again. She's just so happy that these things are all fixed. And I remember in that moment thinking, because I was majoring in psychology at the time.
Mm-hmm.
But and my mindset was just like constantly on things like that. But I just remember thinking, how was the state of this woman's oral health affecting her life in other ways? Her ability to eat things without having pain, her self-confidence when, she's out in public smiling at people, is she hiding her teeth in her smile? When she looks at herself in the mirror, how does she feel about herself? Is it preventing her from getting certain jobs because they're going to be customer facing and the company doesn't want to be represented by somebody who's got a mouthful of cavities? Is she interested in dating someone? And, that person may not be interested because they make assumptions about her based on the way that her teeth look. Just all these things I'm thinking about. And this dentist just fixed all that stuff for her in like 2 hours, right? Just like see problem, fix problem. So I just thought about that for a while. And, I decided I was going to apply to dental school. So, thankfully, grace of God, got in the first attempt. And once I was in dental school, I started seeing some of the things that oral surgeons were doing with their patients and the ways that they were able to impact their lives. And, just knowing that dentistry is is a difficult thing for a lot of people. A lot of people are uncomfortable going to the dentist. Unfortunately, I hear pretty regularly people having bad experiences at the dentist, and that being part of the reason that their mouths are in the condition that they are when they ultimately get to my office, or people being adamant that they can't tolerate treatment without sedation because of some experience that they've had at the dentist before. And, just really being able to help people navigate that, just because it is a scary thing for a lot of people. And
Mm-hmm.
being able to help them get through that experience and have it be a positive experience and help them get back to health is just really meaningful for me. So I decided, like, around my third year in dental school, I was going to apply to oral surgery at the encouragement of several people. My dad for sure encouraged me to. It was actually really funny. I told him I was thinking about it, and I remember telling him I was a little bit nervous about it though, and he said, other people have done it, there's no reason why you can't. And so I started looking into it more. I was spending time in the oral surgery clinic, and I talked to the then program director, he's program chair currently, Dr. George Blakey, who also was incredibly encouraging, but his temperament he's pretty steady. He's pretty matter of fact. So, I'm telling him the same thing, like, I'm not really sure I want to be responsible for putting people's faces back together. And he said, why? He's like, why not? Other people do it. Is there any reason you can't? And I'm just like, bro. So, yes, but, he was very encouraging. Another one of my professors at Carolina, Dr. Glenn Reside, he was very encouraging. And so, I decided that I was going to take the CBSE, the entrance exam, and I was going to apply. I ended up doing a 2-year non-categorical internship at the University of Missouri in Kansas City after I graduated from University of North Carolina in Chapel Hill. And there I was training under Dr. Brett Ferguson, who he was the 100th president of the American Association of Oral and Maxillofacial Surgeons, and my program director, Dr. Thayer Defala. Both of them incredible surgeons, great teachers, took me from the point of joining when I didn't know how much I didn't know to, feeling confident as a surgeon that I was going to be able to help people in a meaningful way. So I got there. I did 2-year non-categorical internship, got beat up for a while, then was fortunate to match into that program as well, where I spent 4 years in Kansas City. So it was a great program. We didn't share trauma with anybody. So the hospitals we covered, we didn't have to share trauma call with ENT or plastics. So, 3 level 1 trauma centers, county hospital, children's hospital, and then a private hospital, all facial trauma going through us. So we stayed busy and we got a lot of experience, but wouldn't trade it for the world. I think it was one of the things that the way that I look at it is it was an experience that definitely helped me grow, and it helped me learn a lot of things about myself. A lot of lessons, a lot of late night lessons about persistence and determination, and just doing what you say you're going to do. Which is hard to do sometimes. So had a lot of great experiences, a lot of opportunities to learn out there. Worked with some great co-residents, some very intelligent people. And once I got done, got an opportunity to come back to Charlotte, North Carolina, and I'm currently working with a group that's DSO associated or affiliated here, and been with them for coming up on 3 years.
Amazing. I mean, that's such an awesome journey, Jackson. And your journey is like probably it actually is. There's no doubt. It's pinnacle hard work ethic. And the thing is, like, I had a friend. He just and I'm really happy for him. And he also same thing. 3 years out of NYU. He just matched this year.
Nice.
I mean, he did a GPR and they did 2 non-cats at like 2 different programs and just kept grinding away. And man, when he matched, I gave him a call. I was like, man, dude. There's one person that deserves it. It's you. And your story reminds me of him. And it's just like, it's a grind, man. Like, when you want something, you get after it. There's no excuses. And I think that's huge. And you have embodied that, and now you're being promptly rewarded for that. So, I think that's amazing. And I think something your dad and your program director had said, hey, if someone else has done it, why the heck can't you do it?
Right.
That's something my father told me. Because there was times where I was like, man, Dad, I can't do this. And he's like, but why? He's like, are you the first one to do it?
Right.
And I was like, no. He's like, people have done it before. You can do it, and you can probably do a better damn job. So get on it. And he's like, there's no nonsense with me. And so I love those type of people, man. So I'm glad that you kind of had to dealt with that same matter of fact. My dad's a physician, so I get it. That background of having two physicians is probably even more intense.
They
But
were they were great, man. They were super encouraging. It's funny because people have asked me before, like, "Oh, are you doing this because of your parents?" And honestly, no. Well,
yeah,
yes and no. It's
uh-huh.
no in the sense that they didn't push me towards this. They didn't say, "Oh, you need to do this," or "You need to, consider jobs like this." It was more so that they never discouraged me from anything. They said,
Correct.
you can do whatever you want to do. It's like you have to apply yourself, you have to decide what you're going to do, and you have to stick with it when it's difficult. But they never said you need to be doing this or you need to be doing that or that. But I think more importantly, they never said, "Oh, you can't do this thing," or maybe
Mm-hmm.
you shouldn't think about doing this thing. It was always, "We'll figure out how you're going to do it."
Correct. Yeah. My dad said the exact same thing. Although he would say one little tidbit, which I will never forget. He's like, listen, I've given you a very good lifestyle to live. He was like, pick a craft or a job that you enjoy that will give you that same life satisfaction. He was like, if you don't, you're going to be very miserable. He's like, I've spoiled you, quote unquote. Not actually, he would actually make us work for things, but I've shown you this lifestyle. He was like, and we lived well. We weren't lavish or anything, but he's like, if you want to do this for yourself and your children, then look at careers that give you the same opportunity. Don't pick it because of me or because you think you need to give it to me. And kind of the funny thing is that was what he told all three of us as siblings, because I'm from a family of three in terms of siblings. We all became doctors and physicians. Like, I'm a general dentist, my sister's an orthodontist, my little brother's in medical school.
Hmm.
And that's all he said. He never said be a doctor, be a dentist, like never forced it on us, but just was like, this is the fact, matter of fact, this is what it takes. Go after it and
Hmm.
don't look back.
Yeah.
So very interesting. Yeah, that's I can really relate to that. So okay, as an OS, what do you see on a daily basis? What are your favorite procedures? What do you not like doing? And what's a moment that kind of not figuratively brought a tear to your eyes, but like made you feel really good about what you do?
Okay, yeah, that's fair. So on a regular basis, I'm doing a lot of bread and butter oral surgery. So a lot of taking out teeth, putting in implants, pre-prosthetic surgeries, so torus removals, benign minor pathologies, cyst and tumor removals, biopsies. I do take trauma call at a hospital, so depending on what comes through there, infections and various forms of trauma, mandibular, maxillary, mid-face trauma. In terms of what I like to do, benign pathology is interesting to me. So yeah, generally benign pathology. Honestly, I enjoy most of what I do. And I think most of the satisfaction, the surgery is engaging and it's challenging at times. So I do enjoy that. I feel like I get the opportunity to kind of learn from my experiences each time because we should be continually critiquing ourselves and figuring out what we would have done differently, if anything, for each one of our procedures. So I find that gives me a lot of opportunities for that. But it's like I was kind of alluding to before. It's really the more rewarding thing, I think, is being able to help people through these things because it's pretty rare that I get somebody who's just like, "Oh, I'm not worried about this at all. I'm not, it's not a big deal. Just get me numb and get it out of there."
Mm-hmm.
It's usually people have some degree of apprehension. So I mean, like I had and this is kind of a double edged thing too. The thing that is, I think, most heartwarming, I guess you could say, or the thing that like I notice kind of gets me sometimes is people will tell me things like, you're the like this is the best experience that I've had in this type of setting, or I was so worried about this, but it ended up being so much better than I imagined it was going to be, and like I appreciate you helping me get through this thing, and that's great, and I always appreciate it. Like every single time, I appreciate hearing people tell me that, and that's what I want for everybody that comes through the office. I have to, and I tell people this all the time. My number one goal is I got to keep you safe. Number two
Mm.
is I want to keep you comfortable. So I'm not going to compromise your safety for the sake of comfort. And if your safety is ever in question, then we're going to do whatever we need to do to make sure that you're safe. But having people tell me that is great, but I wish it wasn't such a novel thing. Like, I wish people didn't come in and say, this is the first time anyone has explained to me exactly what's going on with my condition and what my options are, and given me recommendations about how they would, proceed without like putting any pressure on it. Like, I try to tell people, give them as much information as I can. This is what I see. This is what I'm going based on your x-ray. These are your options. This is what I think that you should do. These are the risks, the benefits of each one of these options. And, this is how we can get it done for you. And, just people tell me things like, oh yeah, no, usually I just go and sit in the chair and, they say, okay, you need a filling in this tooth, open up, which, to be fair, like I'm not there. These are all secondhand stories. So I'm not critiquing anyone, but also if I go in to get some work done on my mouth, I want to understand exactly what's going on. I like for, and it's not that I don't trust you or I don't believe what you're saying. It's just I want to make sure that I understand, because if you make a recommendation to me for something and I don't do my own research into it, if I don't ask you questions like, okay, well, you think I should get a onlay on this tooth? Why would you prefer an onlay to just getting a filling? Is an onlay going to be better in this situation than a crown? But I know that these are questions that should be asked because I have this background. Most of the people that come to see us, they don't have any idea. They're just trusting us, which is a big responsibility. Like we shouldn't take that lightly. So and that's part of like the oath that we take, right? That we're going to respect patient autonomy, and we're gonna practice in a way that is benevolent. Like I'm just here to help you. If you tell me you don't want to do this, that's fine. This is your mouth. This is your health. We don't have to do anything. I just need you to understand the situation, what your options are, and what I can do for you. And if you want to do what I'm suggesting or any of the options I can provide for you, I will do that to the best of my ability.
Yeah, I couldn't agree more. And it's like, you can kind of read the situation too. It's very interesting. Like I've noticed, well, I've been here in Missouri, like there's that one patient population, like the older generation, especially, this is particularly falls on them. They don't question you.
Yeah.
It's very interesting.
Yeah.
They don't. It's just full trust.
Mm-hmm. Whatever
which
you
I think is
Doc.
amazing.
Yeah, whatever you think.
Literally,
you think, Doc.
Whatever you say, Doc. Whatever you say, Doc, I trust you. I'm like, dang, like this is awesome.
Right.
But I can also see people taking a big advantage of that. Like
Right.
especially if you're in the wrong person's chair, they will take advantage. But I always tell them, hey, like this is what I would do in my parents' mouth. So that's how I approach every patient as, would I do this in my parents' mouth?
Well, all I was going to say was that reminds me, we don't want to think that way, that we would have colleagues that would take advantage of people. But I saw the ADA, or not the ADA, ADIA. ADIA came out with their study of graduating seniors for, I think, 2023, the 2023 class. They just came out with a study where it was something like 98% of graduates felt that they had adequate or above necessary training in professionalism and ethics. And I found a study that was taken by like the Texas Dental Society. It was like a 15-year study, 16-year study from like 2000 to 2015 or 2016, and just the state of Texas. But I think that's a pretty like representative sample. And they found that I think it was like 26 or 23% of dental board associated like disciplinary actions had to do with professionalism and ethics. Right. So it's like 98% of us are leaving school thinking, nope, we got this under control. We know what we're doing, what's right and what's wrong, how we should be treating patients. But then, 23, 26% of the claims that are brought up have specifically to do with professionalism and ethics. So it's not everybody, but, people are out there. Like, and, I was reading about a case where, this is in North Carolina, this practice was doing unnecessary treatments on kids. Like there was a kid that, per this report, this kid had like 14 pulpotomies in one sitting. And I'm just thinking to myself, like, it's like this is a kid, and I can't imagine a situation where let's assume that they need all of them. Okay, let's assume that they actually need 14 pulpot. I wasn't there. I didn't see the X-ray, so I'm not gonna say that's excessive or unnecessary because I just don't have the proof. But even if they need 14, having a child sit through that many in one setting, and it's like people are being incentivized. The more productive you are, the more money you can make. So, there are people that are faced, we're faced with that type of decision also on a regular basis. So it's not that, and I don't know these people. I don't know that I'm not going to make any claims about them being good people or bad people or anything. But I think that they're more likely just people, and they may have made one decision that led to another decision, and then all of a sudden we're in a situation where patient care is being compromised.
Yeah, I agree. I agree. And you just have to know if you make a mistake. And it was very interesting because I don't know if it was residency or my first year in practice, where I think it was residency. I want to say it was residency, but I'd made a mistake with a patient. And I don't remember exactly what it was. And my EFTA at that time, she's a lovely woman, I think she's still there, she pulled me to the side and she said, keep your demeanor, keep your honest demeanor, because you made a mistake and you owned up to it and you told the patient. And she said, there's a lot of people out there in prep practice that would never do what you do, but people will always honor and respect that.
Right.
Like, they will trust you more. And something happened actually recently where I made a mistake. I was actually crown prepping tooth number 28. There's no distal tooth to it. And it was the last tooth. He had some back teeth. And I was like, hey, like, we should try to restore this tooth just because it got a massive filling. It's pretty compromised. Let's do a crown prep. And as I was prepping the crown, there was so much decay on that bulk, but on the buccal surface that I actually pulped out. And it's never happened to me before. I was like, whoa, what the? I was shocked. I was like, at first I was like, hey, we're just gonna take a quick break. I like reconvened, got my thoughts, and I said, hey, listen, I made a mistake here. When I was drilling, when I was getting ready for the crown prep, I entered the surface and it broke through your pulp. There's a lot of decay. I'm sorry about that. The good news is we can stop here. I can pull the tooth out for you. I would highly consider doing a bone graft here in case you want an implant here, or even if you want a better prosthesis, like a removable prosthesis to preserve that ridge. And he goes, hey, doc, it's okay. I trust you. Mistakes happen in life. I appreciate you being honest. And I was able to pull the tooth out, put a bone graft, and he was okay to go. And we'll probably either place an implant or do a prosthesis in about a year's time. Depends on, what he decides to do.
Yeah.
But it's that honesty that like people really appreciate.
Yeah, and I think that a lot of people going through dental school, they may not be perfectionists, but they're at least high achievers.
Yes.
And that when you are a high achiever, or you're someone who's persistent or relentless in the pursuit of their goals, when you make a mistake or you have a setback, that's difficult, understandably. But also they happen to everybody. We just feel like they're not supposed to happen because we usually do a good job at these things. So when an outlier happens, it's just, it's like, what the heck is this? Like, I can't believe this happened. It's like, oh, okay, well, now I have this situation I got to do. But one of the surgeons that trained me, his name is Ronald McAmis. He used to tell us all the time, everybody has complications. It's like, don't be afraid of having complications. You need to prepare for your surgeries and approach your surgeries in such a way that you minimize the risk of those complications. But if they happen, the important thing is, how are you going to manage it moving forward? So,
Yeah.
and I think that, to your point, if we're honest with people about this, like, I think people in general, they feel like we try to do a good job for them. Like I don't think most people would sit in the chair if they didn't, or if they had significant doubts about our ability or our intentions. So if you're doing this to the best of your ability and you have a complication or something doesn't go the way that you planned on it going, then you just need to have some recourse for how you're going to remedy the situation, and be honest with this person about what happened and what the options are moving forward. But I don't think anybody, if they're being completely honest, I don't think anybody expects us to be perfect. But I do think people expect us to be competent and to be honest.
Yeah, I think, and that's a big thing. I think owning up to your mistakes, they provide you with good insight, good lessons, and it also fosters a greater trust with your patients. And people like that. They talk about that. That spreads, and it's a good thing. You don't want to be the guy that did a wrong thing and then just kept denying it. But when you own up to it, they appreciate it. And there's a big part of proper planning. I have a cosmetic case that was kind of handed down to me from people that had left our practice, and he'd come in for like a 3-hour appointment, and I actually stopped that whole process. I said, no, I'm going to do it my way to minimize risk and make sure that we get a good product out for you. called him back almost 2 or 3 times without getting paid, just a treatment plan to make sure everything makes sense, make sure everything is minimized to T. And like he even said the other day, he's like, Doc, I really appreciate you taking the time, detailing all this. I know you're not getting paid for your time, but
Hang on one
I
second.
know.
I'm listening. Sorry, I just realized my.
But basically, he
Sorry.
said
Okay, good.
he appreciated the attention to detail, and that was like the biggest thing. Is he was like, I've never had someone be so picky and particular about my teeth, and I'm like, well, it's just how I am, and so I want to minimize that risk to you that you're investing in me and giving me that trust, but I also want to end up giving you a good smile and something that you're proud of.
Yeah, for sure.
So it's kind of interesting. I think there's different ways to cook a fish, but I think if we strive for excellence, then we usually hit it.
Yep, agreed.
What I would say before we transition to fitness,
For sure.
what's is there any part of your journey that you regret, I would say, or anything that you were unsure about, essentially?
That I was unsure about, or currently am unsure about.
Either or, doesn't matter.
Well, I mean, as far as uncertainty, there's always going to be some degree of uncertainty with life. So, I mean, there's nothing in particular that I'm like ruminating on. There's nothing that's just like
Hmm.
sitting on my mind that I'm uncertain about. But in terms of things that I would change, I mean, that's a yes and no. I would say yes in that when I was initially interested in oral surgery, this was my first year in dental school.
Hmm.
I shadowed a craniofacial surgeon, and I just got a little bit psyched out, I think, because I went to go see him do skull surgery on newborns, and I was like, I don't think I want to do this every day. So I kind of let it fall by the wayside for a couple of years. But then, like I mentioned, once third year came around, we got into the oral surgery clinic. I was like, you know what? I actually really do like this. Or, for several different reasons. It's engaging, it's difficult, it's a broad variety of procedures that you're exposed to. So just in terms of time, I think if I had from that first year kept it in my head, this is what I'm going to do, been preparing for the exam, then I may have saved myself some time. But outside of that, not really. And even with that, the 2 years that I spent doing a non-categorical internship, the experience that I got there, you can't replace experience, right? And like I mentioned before, I wasn't in all three of the level 1 trauma centers, but we had to cover 2 of them as non-categorical interns. And the first year that I was there, I was in the hospital-based clinic, and I had another person with me, but they left the program after the first few months and didn't get replaced. So it was up to myself and another non-categorical intern, along with the other categorical interns, to cover the extra call that those people would have been taking. And then the second year that I was there, same thing happened. The person that was in that clinic with me left after a few months. So we had to cover the call that they would have been taking. And going through it, it's difficult. You have less time off. You're, up all night, days in a row, stuff like that sometimes. But like I mentioned before, you learn a lot of things about yourself. You learn a lot of things about, what you can do, what you can handle, what you can work through. So I don't even necessarily know that I would trade that.
Fair. I think that just comes down to learning from experience. And I think could assume with quite certainty that's probably made you a better surgeon, managing different traumas and being awake a little bit longer
Just
and
yeah,
just,
just
you
more
know,
experience, man. I
more
mean,
experience,
the more
more reps.
exposure, yeah, exactly. The more exposure you have to it, the more opportunities you have to see different complications in different situations and scenarios. More opportunities, even if you're seeing things that are similar. If you're with different instructors, they have different ways of approaching these things, and you can figure out which way you think works the best in your hands.
I agree. I completely agree. All right. So Jackson, let's transition away from surgery and your craft a little bit and go into fitness. So you and I are both into fitness, and I know you are into it as well. Talk to me about that. Where did your fitness journey start from? Were you an athlete in high school? Did you pick it up later? What do you do now? You just kind of walk me through everything that you do.
Yeah. So
And yeah,
no, please. And what? Go. What else you got?
and why?
Sure. So when I've been playing sports since I was a kid, like as long as I can remember. I remember my parents having me in soccer when I was really young. I played softball, played volleyball, basketball, ran track. a lot of different sports over time. So that's probably where it comes from for the most part. Is just I'm used to getting up and doing things and moving around, and I don't feel the same when I'm not active. I feel much better when I'm up and doing things.
Mm-hmm.
So when I was in high school, like I mentioned, the main sports I ran track and I played basketball. Had an injury when I was in high school,
Mm-hmm.
just kind of let it fall off after that and just focused on school. But yeah, I love participating in sports. I don't watch sports all that much, although recently I've been more into watching fighting, like various forms of fighting. Whether it's mixed martial arts or boxing, Muay Thai, you know, things like that. And I train Muay Thai. I try to do that at least once a week. I've got a trainer who's great. There's an awesome gym down here in a city called Belmont. Uh, if anybody out there sees this, it's called Gym O. It's a great gym. They have great trainers. They've got some guys who fought in the UFC. Everybody's been really welcoming and encouraging. Definitely want to shout them out. It's a great place. My trainer, his name is Seki. He's the man. He's great. But yeah, and actually I started that. Another thing, I started that when I was in Kansas City, Missouri. I was encouraged by a guy who also worked in the hospital at the time, who was also a Muay Thai trainer. His name is Brian, and of course I'm blanking on his last name right now. But he's got a gym in Kansas City, Missouri called Low Kick Camp. So
Hmm.
if anybody is in Kansas City, Missouri, and they hear this, Low Kick Camp is a great place to train. Very encouraging, very knowledgeable, and it's a great way to exercise. I found it great for a lot of different reasons. It's challenging. It's great exercise. I think it's good for self confidence. Just you obviously never want to be in a situation where you need to use something like that, and you try to get out of those situations if you ever find yourself in them. But just kind of the understanding that if I needed this thing, I have it. It's just kind of nice to have in the back of your head as well. But beyond that, I try to exercise pretty regularly. There's a run club here in Charlotte I just started going to. So probably going to do that at least while the weather's nice. Try to get to the gym at least 3-4 times a week, ideally 5, but schedule's busy. And then try to do sauna, cold plunge at least once a week too. And that's pretty much it for the most part. Other than, if I'm on vacation or something, I try to be pretty active on vacation. So try to do a lot of hiking and exploring in those situations.
Very good. Very good. I know you said you do Muay Thai and fighting. What has that taught you about life? If you could have done it earlier, would you have started earlier?
Yeah, I definitely would have started earlier. If I have kids, then it's something that I want them to be in. It's actually kind of funny you asked that. I had a patient come into the office, and just in the course of conversation, we figured out that they went to the same gym, and they had a few kids with them. And I guess the kids that were with them, they were babysitting as well. And these kids, they were probably, if I had to guess, like there were two of them, between 5 and 7 years old. And they were just the best behaved kids that I had seen in a long time. They just sat quietly. They answered questions when they were asked questions. And, it was interesting because she told me, like, in the course of conversation, we figured out we went to the same gym, and she told me that they trained at that gym too. And I was like, I bet this is all discipline from them having to, train. It's like, no, you need to listen. You need to focus on what I'm telling you. So I always thought that was interesting. And, I would definitely want to put my kids into something like jujitsu or Muay Thai, specifically because they're difficult. Because it's a hard thing to do. It's being
Hmm.
physically uncomfortable and being able to make yourself remain calm and think through the situation that you're in. Kind of pushing yourself past what you perceive your limits to be. And I find that martial arts in general, like, I think that actually I was talking to my coach about this. The difference between a fighter and a martial artist. It's like fighters, they just want to, come out and swing on people and show how much they know and how tough they are and beat up, whoever they can beat up. But martial artists, like, they have a code. They have principles that they
Hmm.
follow and that kind of direct them in their pursuit of mastery of this thing that they're engaging in. And just from the standpoint of trying to instill value, like the value of hard work, the value of persistence, the value of self belief, that you can do difficult things, and that I believe in you, I believe in you, and you should believe in yourself because, like we were saying before, other people have done this before. What's the reason why you can't?
Absolutely. And honestly, like I did martial arts for about 12 or 14 years when I was younger, almost 14, I think. And I pretty much got to black. I never, I took the test, but I never went and got my belt, which was
Mhm.
interesting because I think I just got busy with life. But like I did pass the test, and I had like one more test to do. Um, but I remember being very disciplined, and people say, and I am to this day, and people ask me, they're like, "Oh, why?" And I'm like, honestly, I think it was the martial arts, and it's like I kind of want to go back to it because I miss that like controlled environment of emotions, of physical regulation. I think it has a lot of benefits, and that's why it's been practiced in Chinese philosophy, Japanese philosophy, and their culture for so long. And if you look at them as a people, I'm talking about mainland Japan and China, they're so disciplined. At least back in the day, and the people that practice it actively. And I think it's such an important skill to be disciplined at a young age because when you are that way, you have a higher likelihood chance of being successful in whatever you decide to do. Be it, welding, dentistry, medicine, engineering, whatever it is. It could be anything.
You need discipline for everything. Doesn't matter what you're doing.
Yeah, and I think that's the biggest thing. So, if there's one thing you could add to all your plethora of fitness regimen, what would it be, and why have you not started it?
One thing I could add. Honestly, not really. I mean,
Hmm.
the things that I'm doing in terms of fitness, I feel pretty good about. I feel like from a cardiovascular standpoint, the running, I'm gonna pick that up more, but I think I'm pretty solid with that. And then just fitness training throughout the week, just getting up and moving. I'm pretty happy with the majority of what I have going on. If I could say anything that I would change, it would probably be on the nutrition and like self care side,
Hmm.
just taking care of like recovery, like maybe try to make more time to get massages, making sure I'm getting supplements so I'm not going out and wearing my body out, but then not giving it what it needs to recover and build. So that's probably it.
Good. Very good. That's cool, man. Honestly, like I think in society we don't talk about fitness as much. I mean, there has been a trend, but we don't talk about the little nuances about it. And I think the importance of it, because I think it really does separate you from being the next level essentially. And that's I like to talk about leveling up in life, and I think being active physically is one of those key factors in leveling up.
Yeah,
Yeah.
I agree. That's
But
I can't remember who said this. One of these old philosophers, Socrates, Plato, one of these guys, Epictetus, might have been Epictetus, said
yeah,
the body should be treated vigorously so that it may not be disobedient to the mind.
Epictetus.
Yeah.
That's Epictetus.
Yeah, and I heard
Yeah.
that, and I read that somewhere, and I liked it, and I was like, yeah, it's like this, like I decide what we're doing. It's like I'm running this. We're not going to stop because my body is tired, or it doesn't want. I don't feel like I want to do it anymore. It's like this is what we're doing right now.
Correct. And the thing about constant fitness or consistently being in fitness, there's two things I want to touch on. One is body morphology,
Sure.
and the other one is the grind. When it comes to the grind, people think that, oh, that guy trains a lot, blah, blah, blah. He loves it. Every single day is going with enthusiasm. And it couldn't be further away from the truth. Dude, there's more days I'm like, fudge, I gotta do this again. I have more of those days than let's go lift like 315. Like,
Hey,
I'm ready to go. I
we
have less of those days than, you know,
But we were just
I'm
we were
like,
just talking about it. That's perfect.
yeah.
That's like that is where the discipline comes in, right? Like
Mm-hmm.
you make these things. That's another quote. I can't remember who said this one, but it was something like excellence is what we do, or greatness is where success or something is what we do continually. So excellence is not like a trait or something. It's a habit. It's like you don't get up and get in shape or you don't get up every morning like thinking I'm so happy to be awake at 4:45 and about to go, physically exert myself and then go to work after this. Like
Yeah.
most people don't wake up thinking like, "Oh, I'm so happy to be awake right now and go do this thing." Most people wake
Yeah.
up and they go, "Ugh, all right, time to get at it again." And it's
Yeah.
it's just that discipline. It's building
Yeah.
that habit of doing this thing over and over and over again so that when you don't do it, you feel worse. Like if I don't get up and go to the gym for enough time, I'm like, I don't feel as good. It's like, man, it's like I feel like I need to go do something. I like just my body doesn't feel active enough.
Correct. And I wake up at 4:45 Monday to Thursday, sometimes on Fridays if I feel it, because I work Monday to Thursday. And there was a point maybe about 2 or 3 weeks ago, it was post Ramadan and I was kind of exhausted. I was still going to the gym during Ramadan, but I was just like, man, like I'm getting home at 6. I really don't want to go to the gym and then eat dinner. And it was like for like 2 weeks, I was like just not going Monday to Wednesday. And I'm like dragging so hard. And I'm like, what is wrong? And I'm like, no, I need to at least in these 3 days go at least twice. And then I'll go Monday, Wednesday, Thursday, Friday, Saturday, Sunday. Like I'll just hit it and just
Hmm.
take off just Tuesdays off. And I got my energy back. And I'm like,
Yeah.
yeah, it was the working
You
out.
just got to
That's
get
what was
into it.
missing.
Yep. You just got to
Yeah,
get
it's just like
into it.
I have no excuse, you know? But you have those periods where you're like, man, I just don't feel great, but you just got to do it and just
Right.
show up and show up. And it brings me to the second point. It's like, we see these like jacked people in the gym or these extremely fit people, and that's not always the case for a lot of people. Some people are just fit in their own body types and they look decent, but they're not going to have like the big deltoids and the big back, the big chest, and the big legs. We all have our strengths and weaknesses, so we can't compare our bodies to them. But what we should be is
No.
like, are we
Am I
doing
better
it
than I was
consistently?
yesterday?
There you go. And the only easy day was yesterday, you
Right.
know? It's a Navy SEALs thing. And if you can say that confidently, then you've done enough, in my opinion.
Yeah. And it's a thing
But,
that it like I was saying before about something else. It's a thing that ebbs and flows too.
hmm
I have stretches where I'm really consistent and I'm on this schedule that I want to be on for, months at a time. And then there are things that kind of throw your schedule off. I was doing some traveling earlier this year, and while I was traveling, I wasn't consistently going to the gym. And then once I got back here, it took me a couple of weeks to get back into that groove. And that's just honestly, that's just a lack of discipline on my side from not getting right back into it. But also, you gotta kind of listen to your body sometimes. And sometimes,
hmm
with traveling and stuff, going to different time zones, I just felt like, okay, I need to be doing something, but not what I would do regularly if I had been here, getting consistent sleep, eating regularly, and all that stuff like I normally do.
Yeah, I agree completely. I couldn't agree more. Yeah, that's I think we touched a lot about on fitness and life there. So let's kind of head towards the last segment of the podcast, and that is, what was it like growing up in North Carolina as a kid? Did you have a lot of struggles? Did you have a lot of successes? Being people of color, you and I, we have our stories and everyone's different. But I think it's something that it's difficult to talk about, but I think it's nonetheless important to talk about.
Mhm.
So I'd love for you to share that part of your story.
Sure. So growing up, I think, and I think about this somewhat regularly too. I was actually talking to my friend about it the other day. At one point, when I was in dental school, my friend and I, who was in my class, we were driving down to the beach. There was like a music festival or something going on, and we were going down the night before, and it was close to midnight. And there were a bunch of guys working construction on, along the highway. And I just turned to him and I said, "What do you think is the difference between us and them?" Because they're not lazy. Like they clearly have some degree of motivation. Like they're out here in the middle of the night doing manual labor. Like
hmm
it's not that they have no drive. So like, what do you think is the difference between us? And I think what we got to was opportunity. Sometimes if you have responsibilities, like you got to provide for yourself or family members or something like that, sometimes you just may have to take whatever job you can get. You may not be able to dedicate time to going to school, like time and resources to your education, even though that may be what you want to do. So growing up, and to this day, I try to be exceedingly aware of the fact that I have grown up in a unique situation. Specifically, what I told him was, if we think about it in the history of the world, if you live in like a middle class home in the United States, you're living better than 99 point whatever percentage of people who have ever existed. Like you were living more
hmm
comfortably than those people. And then if you live beyond that, which to wherever you place people in this like spectrum, my parents, they worked really hard and they had help along the way, and they were able to put themselves into more favorable positions and help their families and provide for me and the lifestyle that I had growing up. And I grew up very comfortably. We would go on vacations. I never worried about the roof over my head or where my next meal was coming from, or really much financially or emotionally. My parents were both very present. I felt like if I needed anything, I could always go to them. They were always very encouraging. They weren't really strict, but they were very well understood expectations.
hmm
And I think did a good job of learning me and parenting me, because I think inherently I was always kind of like a good kid. Like, I wouldn't really, like, my dad told me some story recently about how his dad got a new car and he took it out to one of his friend's shops and they did some modifications to it and they took it drag racing. And I was like, bro, I should have been doing way more stuff when I was a teenager. It's like you're out here stealing your dad's car and making upgrades to it and then racing it. It's like, okay. But I think that I was very supported. I had a lot of advantages that I try again to be very aware a lot of people didn't have growing up. So I try not to take that for granted, and I try not to let opportunities get away. And beyond that, I try to use those opportunities to create opportunities for other people who may not have had them, who may not have been in this favorable of a position. So yeah, so and like you said, this is the United States of America. If you grow up black or brown, you're going to have your experiences.
Mm-hmm.
I definitely had, I think my share of experiences. Thankfully I was always safe, and I was very fortunate to have, a multicultural friend group.
Mm.
So when I was I remember when I would say by the time I got to high school, I had friends, or I had been like in school with people of pretty much every ethnic background except for maybe Middle Eastern. And by the
Mm-hmm.
time I got to college, I had some Middle Eastern friends. I had some Middle Eastern friends when I was in dental school. So I think I was fortunate to grow up early on, recognizing that people from different backgrounds with different perspectives, it it doesn't really mean anything other than that they grew up different than you did. Their perspective and their experience is valid. And it's also unique and individual to them. So while they may be from this place culturally, or may have had some of these experiences culturally, it does not automatically group them into this group of people. Like, you're from here, you must be this, or you must think this. It's like,
Mm.
so that was never a thing in my mind, because I had these various friends from various backgrounds who all had different experiences. And you just recognize that for the most part, people are people. They want to live well. They want to provide for themselves and their families. They want to improve their position in life. And mostly they want to have peace and be left alone.
Yeah, that's very well said. Very well amalgamated.
Most
Yeah,
people don't
you're
want to
right.
mess with you. They why are you messing with me? Leave me alone.
Yeah, and the adage is, don't mess with someone's money, their time, or their family, and you'll be on good terms with them 99% of the time.
Yeah, generally. Just, the thing they try to teach you in kindergarten, the golden rule, right? It's like
Yeah.
people get to second grade and they forgot it already.
Yeah, they really do. They really do. All right, Jackson, I've got about three more questions I'd like to touch base on. And this
Sure.
one I didn't mention to you, actually. I thought about it as we were talking. So I might just throw you a little bit of a curveball, but I tend to
Please.
do that.
That's all right.
So the first question here is, there's one thing about society you could change. What would it be and why?
That's a loaded question. That's a very loaded question. One thing I would change about society, I don't know that there's one thing, and I don't know.
Gotta pick one.
I feel like whatever I choose, I'm going to be leaving something out.
That's all right.
I think if there's one thing, and this is going to be kind of I'm kind of it's kind of a cop out. If there were one thing I would want everyone to have to, like, forced, like, you don't get a choice. Like, if we all had stats, like, if we, like, this was a video game and you could see your individual stats for stuff, like compassion, I need you to compassion maximum. It just needs
Yeah.
to go up to the highest setting for everybody. So at least in my mind, in that scenario, there's nothing malicious. At the very least, compassion would require all of us to try to stop and understand the other person or other people's perspective and place ourselves in that scenario. So if we didn't want something for ourselves, or if we would want something for ourselves, kind of like we were talking about with the earlier on today with the different implants, like if you would not let this thing be placed in your mouth or in a family member's mouth, then why would you use that part on anybody? Right. So whatever you want for yourself and your family, then why would you not want the best for everybody? Like, we can all win.
Correct.
There's no reason why not.
Absolutely. I love that answer. That's a very good answer. It's not a cop out at all. Okay. So when you die, what do you want it to be written on your gravestone, and why?
To be honest, I have no idea. I have absolutely no clue. Yeah, I don't know. I mean, part of me would want to find something that's kind of like profound or, some quote from somebody, but I don't think I'd ever be able to narrow it down to one. I think more so like less being on the headstone, but more so just like a overall like he's gone. This is the thing that I want you all to think about. Maya Angelou has a quote: "People might forget what you say, but they won't forget the way you made them feel." And if at the end of my life there are hopefully significantly more, but if there are more people who feel like I was a positive influence on their life than someone who made their life more difficult, then that's all I can hope for. We do the best we can, and I try to remind people whenever I have existential conversations, this is all of our, at least to my knowledge, this is all of our first time through this. Like, none of us really know what we're doing. We're just figuring out as we go, and we try to do the best that we can. And that's another Maya Angelou quote: "Do the best you can until you know better, and when you know better, do better." Just, you know, do your best. Try not to hurt anybody along the way.
Fair. I like it. I like it. All right. And the last of my questions for you is, who is Jackson in one word? You're picking up a trend here.
Yeah,
It's
if
the
I could
one thing.
if I could come up with, I mean, honestly, I'm gonna say persistent, and I don't necessarily know that I am, but it's something that I strive for. It's something that I try to actively pursue. And actually, I'm gonna see if I can find this real quick. By see if I can find this, I mean like I already pulled it up, and I knew I want to talk to you about it at some point. But like during the IDL program, this is what I closed with. This is Calvin Coolidge: "Nothing in this world can take the place of persistence. Talent will not. Nothing is more common than unsuccessful men with talent. Genius will not. Unrewarded genius is almost a proverb. Education will not. The world is full of educated derelicts. Persistence and determination alone are omnipotent." So, it's, you just do the best you can. Do the best you can, and if you get knocked down, you get up and you try to do better the next time. Fail, fail again, fail better, right?
I agree. I completely agree with that. I think it reminds me of that. I think it's Theodore Roosevelt. I think it is. Or maybe, yeah, I think it is. The Man in the Arena. I don't know if you're familiar with that one, but it's very similar to that. I think we've touched on it in this podcast and our conversation before the podcast is persistence and discipline are the two biggest success factors. And I touched it on during my idea presentation with Grit by Angela Duckworth, and she says the same thing. The people that are the most successful in whatever industry or field they choose to be a part of, it's because of those two founding principles.
Yeah,
so
man, I can see it.
yeah, but Jackson, man, it was an absolute pleasure having you on the pod. I could talk to you about hours and hours about this stuff. I mean, we were
Don't worry,
talking
we
about this
will.
during IDL too. We will, and we definitely will. But thank you for your time on a Sunday morning. It was a pleasure as always. So thank you again for your time. And if you have any closing remarks or advice for the audience, it'd be a great time to say it.
Only closing remarks: be kind to each other and keep going.
I love it. That's great. And with that bombshell, thank you again, Jackson. Take care. And to my Mind, Body, and Roots audience, thank you again for tuning in to another episode. Be well.